Okay, let's review the thoracic spine. As you know, this region is the least mobile. This extra stability is due to the costotransverse and costovertebral and sternocostal joints between the vertebra, the ribs, and the sternum in the front chest. The main reason for this is to protect the heart, the lungs, the aorta, and the vena cava, which are located in the thoracic cavity. And because this cage is elastic, its capacity to absorb energy increases up to 3 times. If you take air and hold it in your lungs, you will notice that the thoracic cage can resist high forces due to that intrathoracic pressure that you create by inspiring deep. You also know that the kyphosis of this section of the spine is a primary curvature with its apex at T7, T8. You also know that a slight lateral curvature is normal, and some authors related that to the hand dominance of every individual, and some others to the position of the aorta. An important detail to chiropractors is that women under 40 have a more straight thoracic spine than men, but this begins to change at 40, and this section becomes more and more kyphotic in women. Some authors relate this change to pregnancy and breastfeeding. Anyway, any increase in kyphosis will turn the thoracic spine more stiff, and this may cause musculoskeletal disorders. So have this in mind when you see women above 40. Gravity also has an effect to increase kyphosis along the years, although some structures resist this effect. You have intervertebral discs and sigapophyseal joints especially that will resist anterior translation and rotations of the vertebra. At this section, the discs account for 1/7, or is more or less 15% of the total length of the spine. Remember that in the cervical section it was up to 25%. At its center, the discs have a nucleus pulposus, we will see that later, that acts as a shock absorber. This nucleus is quite small here in the thoracic spine and suffers less swelling, less problems than in all the other two sections of the spine. As you see in this image I draw for you, the thoracic discs are shorter in height and narrower in length than the lumbar ones. But due to the properties of this fibrous material, the resulting flexibility is more or less the same for the thoracic and the lumbar sections. In the thoracic spine, ribs are responsible to resist torsion, while in the lumbar spine, the sigapophyseal joints that resist this movement. Let's see now the different thoracic vertebrae. Okay, the typical ones are T2 to T9. They have the common features of a typical vertebra. We already went through that. And here the shape of the bodies change from rectangular at the top to the larger oval shape characteristic of the lumbar vertebra. Also, the angle of the spinous processes evolve from horizontal near the cervical section to more vertical as they descend. Then at the end they tend to become also horizontal, because the lumbar section has horizontal spinous processes again. The transverse processes of these thoracic vertebra are oriented laterally but become more and more posteriorly oriented as they descend, because that's how the lumbar vertebrae have it. The body has half a facet to articulate with a rib. As you see in the right image, the superior demifacet articulates with the rib above. So if this is T4, it's gonna articulate with T3, and the inferior ones with the same rib. Okay, so if this is T4, the inferior facet is for the head of the rib number 4. Then we find a facet in the transverse process, which is for the tubercle of rib 4. Again, that's the same rib. And to finish, have in mind that the orientation of the articular facets of the zygapophyseal joints shown in the yellow box. Okay, here you can see the details of T7 as an standard thoracic vertebra. Okay, T1 has some particularities. It is very similar to C7, but its body has a complete superior facet for rib number 1. The inferior body facet is already a demifacet for half of the head of rib 2. Here the transverse foramina is missing, as well as the uncinate processes that were typical in the cervical vertebra. You can check out here the characteristics of T1. T10 has some distinctive characteristics also. Its body has a complete superior facet for rib number 10, while the inferior demifacet is missing, and its transverse processes still have a facet for the rib. The spinous processes begin to look like the ones of the lumbar vertebra, so they are more horizontal, short, and strong. And regarding the zygapophyseal joints from T1 to T11, the inferior facets look anteriorly, but this changes from T12 to L5, where they look laterally. While T10 has a facet in its transverse process, T11 and T12 do not have it, because rib 11 and rib 12 are what we call floating ribs, so they don't articulate with the transverse processes. Okay, take a look to T10 and its details. This is a massive body here, because the weight at this level is quite important. Alright, so T11 also has a complete superior facet for the rib at its body, but lacks the one of the transverse process, as you can see in this image. And here you have the real image. T12 is like T11, but its spinous process is even more horizontal and massive, so it looks very much as a lumbar vertebra. Here you have the drawing, and here you have the picture. Regarding ligaments, we are not going to repeat them because they are very similar to the ones on the cervical section. So we have the anterior and posterior longitudinal ligaments. We have the articular capsules of the zygapophyseal joints. We have the ligamenta flava, which are more elastic at this level to help recover the upright posture after a flexion. We have the interspinous and supraspinous ligaments, and finally the intertransverse ligaments. Okay, check now the orientation of the facets of the zygapophyseal joints. In a horizontal plane, the facets form the arch of a circle, as you see here in the right top image. Their angle with the vertical, as you see in the image of the whole spine, the angle with the vertical of these zygapophyseal joints of the thoracic spine change from 60 degrees in the upper thoracic spine to 80 degrees in the middle thoracic spine. And here you have a picture of a section of an intervertebral disc. We can distinguish an external annulus fibrosus that contains a central nucleus pulposus. The annulus is made of fibrocartilage, but it is reinforced by a layer around externally of collagen fibers. The nucleus pulposus is like a jelly that can absorb compression, so it's like a shock absorber. And remember that if the annulus fibers break, the nucleus can protrude and cause an intervertebral disc herniation, which usually happens towards the spinal nerve and can cause some disorders and pain. Regarding the ribs, their heads articulate with two vertebral bodies and the disc in between them at the costovertebral joints. The tubercles articulate with the corresponding transverse process at the costotransverse joints. Remember that ribs 1, 10, 11, and 12 are particular in this aspect. To finish, let's see the details of these joints, starting with the costovertebral ones. These are synovial joints consisting of two facets on the head of the rib that fit the costal facets of two vertebral bodies with a disc in between. They have a loose fibrous capsule to permit movements, and an intra-articular ligament helps attach the rib to the intervertebral disc. Finally, the capsule is reinforced by a radiate ligament in the anterior aspect. And these features vary a bit in ribs 1, 10, 11, and 12. Costotransverse joints are also synovial with a thin capsule. Here we find a superior costotransverse ligament with anterior and posterior fibers that hold together the neck of the rib and the transverse processes. Then we have a lateral costotransverse ligament that attaches the rib to the tip of the transverse process. At the front of the chest, the bony rib articulates with a costal cartilage that in turn will articulate with the sternum this is for ribs 1 to 7. The joint between the first costal cartilage and the sternum is of a cartilaginous type and belongs to the synchondrosis group functionally. All right, so no movement. While the joints 2 to 7 are synovial and have an intra-articular ligament. These are reinforced by an anterior and posterior radiate ligaments where fibers from the pectoralis major muscle attach. We'll see this muscle in the lecture about the thorax. Finally, one particularity of the thoracolumbar junction is that when in extension, only flexion is possible. So rotation or lateral flexion, they are not possible. All right, so this is all for this section of the spine.